Okay, let's unpack this. Imagine a silent, invisible threat, lurking on city rooftops, maybe,
Hmm.
capable of bringing a bustling metropolis, well, pretty much to its knees.
It sounds dramatic, but it can happen.
And that's precisely what New York City faced in August 2025. A deadly vapor-borne disease, Legionnaire's disease, swept through Upper Manhattan.
Yeah, it escalated quickly, not just a small cluster.
Exactly. It wasn't just localized. We're talking 83 people infected, tragically 3 lives lost, and 21 people hospitalized across parts of Harlem and Morningside Heights.
And the likely source, those cooling towers.
Right, those big structures you see on rooftops, the ones cooling buildings by releasing mist if they're not maintained.
Uh-huh. Contaminated water becomes airborne mist.
And what seemed particularly unsettling this time was, well, the struggle for clear information. City officials faced scrutiny, didn't they, for not immediately releasing the addresses of buildings with these contaminated towers.
Yeah, there was some back and forth about privacy laws. IPO was mentioned, though later clarified it created confusion.
So this whole incident, it forces us to look at, not just the immediate danger of these airborne pathogens, but also how public trust works during a crisis, how it's built, maybe how it gets eroded.
And rebuilt. Plus, the crucial role of just maintaining our city infrastructure.
Absolutely. So how do these invisible threats actually spread? And what vital lessons can we take away to, better protect ourselves and our communities? Especially in a world that feels, well, increasingly connected to these unseen dangers.
Mm-hmm.
Today, we're doing a deep dive into the science behind airborne disease transmission. We'll use this recent NYC Legionnaires outbreak as our main case study.
Good plan.
We'll explore how these pathogens move, what factors influence their spread, environmental, human factors, how public health systems respond.
And the broader impacts, too, social, psychological.
Exactly. So before we get right into the Legionnaires' specifics, maybe we should just lay the groundwork, understand the fundamental science, how diseases can travel through the air.
Right.
Sounds simple, maybe, but when you dig in, it gets really interesting.
It really does. What's fascinating, I think, is how these microscopic particles carrying bacteria, viruses, fungi, you name it, get suspended in the air around us.
Okay.
We used to have this idea of clear size cutoff, maybe like 5 micrometers. Below that was airborne. Above that was a droplet that would just fall quickly.
Right. I remember that distinction being made a lot.
But the science now shows it's more of a continuum. Exhaled particles come in a whole range of sizes.
Huh. So it's not so black and white.
Not at all.
Yeah.
And their fate, how far they travel, how long they stay floating, it really depends on environmental conditions. Smaller particles, they can stay suspended way longer, travel much farther. We're talking dozens of feet sometimes.
Dozens of feet. Wow. Okay. So what does this all mean for us? How do these things actually get into the air in the first place?
Well, the obvious ones are everyday human things, right? Breathing, talking, and then more forceful actions like coughing, sneezing.
Sure. Makes sense.
But it's not just about breathing. The sources point out some really surprising things, like showering or flushing toilets.
Wait, flushing toilets? Seriously?
Seriously, it can create this plume of aerosols if the water's contaminated. Atomization from tap water, even sewage aerosolization in some contexts.
Okay, that's unexpected.
And it's not just water. Even things like wet cleaning surfaces or walking on a carpet or even just skin shedding can kick up aerosols that have settled back into the air.
So they can get resuspended too.
Exactly.
And once they're airborne, floating around, how do they usually get into our bodies?
Mostly through our respiratory system. Your nose, throat, sinuses, lungs. That's the main doorway.
Okay.
And from there, depending on what the pathogen is, it can potentially spread further in the body and cause illness.
Got it. So beyond just how they get airborne, what else influences how effectively a disease like this can spread?
Oh, this is critical. Environmental conditions play a massive role.
Like what?
Think temperature, relative humidity. They really impact whether a pathogen survives and how infectious it remains.
Okay.
For example, cold, dry conditions. They tend to favor influenza survival.
Hence why flu season is often in winter.
Precisely. But there's more. Things like pH, salinity, wind, air pollution levels, even sunlight, solar radiation, they all factor in.
It's a complex mix.
It really is. And then, of course, there's our built environment. Poor ventilation indoors, crowded rooms. These things dramatically increase the risk. They let aerosols build up, spread around without anyone realizing.
Right. Makes total sense. Okay, let's pivot back to the specific event that prompted this deep dive. the Legionnaires outbreak in New York City. We know it's a severe pneumonia, but how exactly does Legionella work, and what were the specifics of what happened there?
Okay, so Legionnaire's disease is caused by a bacterium, Legionella pneumophila. The really key thing to understand is how it spreads. It's not person to person.
Right, you don't catch it like a cold from someone.
Exactly. And you don't get it from drinking contaminated water either. You get sick by inhaling mist or vapor aerosols that contain the bacteria.
Okay, inhaling mist?
And in that New York City outbreak, starting July 25th, 2025, the source was traced pretty definitively to 11 buildings in Central Harlem. Specifically, their contaminated cooling towers.
Those rooftop units again?
Yes, those large structures cooling buildings by dispersing heat as mist.
Yeah.
If the water inside isn't treated properly, it can become stagnant, and Legionella can just multiply like crazy.
Turning them into, well, aerosol generators for the bacteria.
Essentially, yes.
So what was the scale of this outbreak? You mentioned the numbers earlier.
Yeah, as of August 8th, 2025, the final tally was 83 people infected, 3 deaths, very tragically, and 21 people needing hospitalization.
And it was geographically clustered.
Very much so. Concentrated in specific ZIP codes in Central Harlem, East Harlem, and Morningside Heights, 127, 127, 135, 137, and 139. That clustering was a huge clue for the public health investigators.
And who's most at risk from this? Is it dangerous for everyone exposed?
That's a really important point. Most people who breathe in Legionella actually don't get sick. But certain groups are definitely at higher risk. People aged 50 or older, smokers, anyone with chronic lung disease like emphysema or COPD.
What's COPD?
Chronic obstructive pulmonary disease.
Oh, yeah.
And also people with weakened immune systems, maybe due to illness or medications.
Okay, those are the higher risk groups. What symptoms should people look out for?
Symptoms usually show up between 2 and 10 days after you inhale the bacteria. It often starts feeling like the flu fever, chills, muscle aches, a cough.
Pretty general symptoms initially.
They can be, but headaches, fatigue, confusion, sometimes diarrhea can also occur. And it is a severe pneumonia. If it's not diagnosed quickly and treated with the right antibiotics,
It can get serious fast.
very serious. Life-threatening complications like respiratory failure, kidney failure. The death risk is significant, somewhere between 10% and 25%. So early diagnosis and treatment are absolutely vital.
Wow, okay. And what about the rules? Are there regulations for these cooling towers? Did the outbreak reveal any gaps?
Well, yes, New York City does have laws. Building owners are required to register their cooling towers, maintain them, test them routinely, disinfect them.
So the rules exist.
The rules exist. However, a key detail that emerged from the sources was that inspections of these towers had actually happened less frequently after the COVID-19 pandemic.
Oh, why was that?
It sank to a near-record low in the months right before the outbreak, apparently due to a shortage of inspectors.
Staffing issues. Resource constraints.
Seems like it. After the outbreak, of course, all 11 of those identified towers got immediate remediation, cleaning, disinfection, and were scheduled for retesting.
So it highlights that vulnerability regulations are only as good as the ability to enforce them.
Exactly. Resources, staffing, consistent follow-through, they're critical.
So when an outbreak like this does happen, public health authorities step in. What's the typical playbook? How do they try to manage and control the spread?
Well, if we look at the bigger picture, you really need a multi-layered strategy. It starts with prevention vaccines, if they exist for the disease in question. Then you have what we call non-pharmaceutical interventions. Things like wearing masks or respirators, social distancing stuff we all got very familiar with recently. But maybe even more important, especially for things like Legionnaires, are engineering solutions.
Engineering? Like what?
These are higher up the chain of control than just personal protection. Think effective ventilation systems in buildings, making sure there are high air changes per hour, ACH, basically swapping out the indoor air frequently.
Okay.
Or using really good air filtration, like HEPA filters, which trap those tiny particles. Even UV radiation can be used to disinfect air.
So modifying the environment itself.
Precisely. And alongside all that, you need strong surveillance. Rapid reporting systems so that local health departments can immediately flag suspected outbreaks to higher-level offices and coordinate a response fast.
That sounds like a solid layered approach. But as we touched on, in this specific NYC outbreak, the communication aspect became, well, a sticking point.
It really did.
What did you find most notable in the sources about how information was handled, especially with public trust being so crucial?
Yeah, this whole episode really puts a spotlight on public trust during a health crisis. The city officials definitely faced backlash for not immediately releasing the addresses of the buildings with the contaminated towers.
And the initial reason given was IPA.
Mayor Adams initially cited IPA, the medical privacy law, but that explanation didn't quite hold water in this context, and his own spokesperson later walked it back, saying IPA wasn't cited by health officials, and the mayor used the term figuratively for privacy concern.
Figuratively, okay.
Meanwhile, the health department's line was that you could only get sick from breathing the mist outdoors, not from just being inside the buildings.
Which might sound reassuring, but maybe also confusing if your building's tower is implicated.
Exactly. It created these discrepancies, this perception, fair or not, of a lack of full transparency. Officials then found themselves having to actively work to dispel rumors by getting more information out there.
It really shows how critical, clear, consistent, and frankly, prompt communication is.
Absolutely.
Yeah.
Because in that information vacuum, fear and misinformation can spread faster than the actual disease sometimes. Trust, once eroded, is hard to regain.
Yeah. Beyond the immediate health crisis and the communication tangles, outbreaks like this often have significant psychosocial effects, don't they? How do people tend to react?
Oh, definitely. History shows us that infectious diseases often trigger a level of fear that's kind of disproportionate compared to other health threats.
Why is that, do you think?
Well, they're invisible. They can spread incredibly fast, and they have caused massive death and suffering throughout history. It taps into something primal, I think.
Leads to that germ panic idea.
Yeah, exactly. Anxiety, sometimes even irrational behavior. And the media landscape can sometimes amplify this, with scarce statistics or overly dramatic headlines that feed into that subconscious sense of threat.
And the sources also mention stigmatization. What does that look like in an outbreak?
This is a really unfortunate side effect. The person who gets sick can be seen as both a victim and a vector, someone who is suffering, but also someone who could potentially spread the illness.
Creating blame or suspicion.
Exactly. It can lead to unfair stigmatization. We saw it with SARS, affecting Asian communities. We saw it with a Hanyana virus outbreak in '93, unfairly labeling Native Americans.
That's terrible.
It is. And even necessary public health measures like isolation or quarantine, while vital for safety, can infringe on liberties and inadvertently worsen that feeling of stigma. It adds another layer of suffering.
So pulling it all together, this Legionnaires outbreak, the broader science of airborne diseases, what does it teach us, especially thinking about what we all just went through with COVID-19? What are the key lessons for being better prepared next time?
Well, connecting it to the bigger picture, the COVID-19 pandemic really laid bare some major systemic weaknesses, particularly in places like New York State. But the lessons are universal. Fragmented healthcare systems struggling to coordinate. Severe staffing shortages made worse by a lack of unified federal, state, and local response plans. Overwhelming burnout among healthcare workers.
We definitely saw that.
Huge supply chain failures, too. Remember the scramble for PPE? That was partly due to just-in-time inventory systems and over-reliance on single suppliers. It led to critical shortages, price gouging.
A total mess.
And circling back to communication, just massive breakdowns, inconsistent messages from different authorities, leading to confusion, mistrust, often amplified by the politicization of basic health information.
So, given all those painful lessons, what are the actual recommendations? What concrete steps can be taken to shore up our defenses?
The recommendations cover a lot of ground, aiming for a more resilient system overall. Big ones include enhanced funding and expanding the public health workforce.
More people, more resources.
Definitely. Also, developing dedicated crisis communication teams, building stronger relationships with local media before crisis hits to help with public health literacy and fight misinformation effectively.
Proactive communication.
Yes. Standardizing data collection and guidance across different regions so everyone's working from the same playbook. Identifying and really pushing best practices for facility design and maintenance, especially things like HVAC systems and, yes, those cooling towers.
Do the infrastructure right.
Crucial. Expanding telehealth is another big one, to maintain access to care when in-person isn't possible or safe. And applying principles of human factors, engineering basically, designing systems and processes to be safer and easier for both patients and staff, especially under stress.
It sounds like a comprehensive overhaul, really.
It needs to be. The goal isn't just to protect physical health, but also to lessen those damaging psychosocial consequences that always come with outbreaks.
So what does this all mean for you listening? Well, from that invisible dance of aerosols to the very visible complexities of a city health crisis, hopefully this deep dive shows that understanding airborne diseases and public health isn't just science. It's about this intricate web-connecting infrastructure, communication, trust, human behavior, all shaping our collective health and safety. Maybe the next time you walk past a building with a cooling tower or see a local health alert.
You'll have a bit more context.
Exactly. A deeper understanding of those silent forces at play and maybe a greater appreciation for these systems, both seen and unseen, that are there to protect us.
Hopefully.
And maybe a final thought to leave you with. How much do we as a society truly value that unseen infrastructure? The unglamorous, often thankless work of public health officials? Do we only pay attention when a crisis hits?
It's a good question.
And what responsibility do we each hold in demanding and contributing to transparent communication, in thinking critically even when we're faced with fear and uncertainty? Something to ponder.